Hello, this is Christian Witt, the President and CTO of Beyond Lucid Technologies. We sell software and services to fire and emergency medical service agencies nationwide. We're a lean and profitable health and safety IT company whose mission is nothing less than to own the pre-hospital data pipes. We are doing this in two stages. In our first stage, our MediView pre-hospital HIE focuses on moving pre-hospital patient data where it needs to go. That is, we ensure that information about a patient is conveyed from an ambulance or fire service into the hospital, nursing care facility, clinic, dialysis facility, or elsewhere that it needs to go in order to ensure that it's available ahead of the vehicle's arrival for decision support, triage team activation, pre-registration, and a more efficient patient turnaround. In Phase 2, we will use Halcyon post-crash intelligence to bring existing patient data to the responders, mainly focused on connecting vehicles that have been involved in a crash with the ambulances and fire services that are en route to the crash scene, so that when the emergency responders arrive, they'll have some idea of who's involved, whether they're conscious, moving, what's their health history, and perhaps most importantly, the number of passengers that were likely in the vehicle and impacted by the crash. Today, 50% of critical information captured over a 27-minute average first aid and transport period is lost during the 45 to 60 seconds of handoff of critical patient information at the receiving care facility. In other words, after everything that emergency service providers have done to save the lives, provide care, gather situational awareness about who, what, when, where, and why, while the patient is being transported to a care facility, one can flip a coin as to whether the receiving care facility will know any or all of that context when they take that patient in, and which currently leads to restarting patient care upon arrival. We think this is a critical flaw, operationally, clinically, financially, and our business objective is to close that data chasm so that more information is available faster, with higher integrity, and made available to the clinicians who are going to have to use that information next in the patient care chain. We've been in the market for 5 years, and we've been profitable for the last 2 years. Our team's experience spans government information technology, autonomous self-driving vehicles, and connected cars. Our chief engineer is widely considered as the foremost expert on EMS data in the United States. Again, Phase 1, MediView connects ambulances and hospitals via a pre-hospital health information exchange. Phase 2, through use of the MediView infrastructure that we've already put in place across the country to ensure that the responders arriving at the scene of a crash know who was involved through Halcyon post-crash intelligence. This is the heart of our difference. First, ensure that the information arrives quickly ahead of the responder and is made actionable so that they can share that information without the need to double chart, without the need to redo what's already been done, because it's the source of so much cost and so much increase in risk and morbidity. We can connect with some 90% of fire and EMS agencies' existing software across the country, and our objective is specific in terms of efficiency. We want to reduce the documentation burden by 60% of the national average of 20 minutes, or down to 8 to 10 minutes in a 911 context, and MediView has done so repeatedly. MediView also shares that information up to 3 days faster than our closest technical competitor in just 30 seconds from ambulance to hospital. Beyond Lucid is working with more than 65 EMS and fire agencies across the United States, as well as several of their partner hospital systems. We've processed now close to 80,000 records within MediView, and we have the capability to mine that data, as well as to provide greater decision support and insight to our partner client. Beyond Lucid is closing the data gap, ensuring that the amount of information retained and made useful on the receiving side of that handoff really centralizes on the role of fire and EMS in our American healthcare system, and our goal through them to save lives, one patient at a time. Thank you.